Hey everybody,
Hey, everybody.
welcome to the Botanical Biohacking Podcast. We're glad you could make it. Today we're going over gut dysbiosis and its relation to chronic pain. So if you have chronic pain in the membrane, this is the place to be.
So I thought we'd start out, Dr. Miles, with a case presentation. I refer a number of patients to you when I'm throwing up my hands. But I saw a woman the other day, 44-year-old, who has had chronic pain for about 15 years. She's not sure exactly when it started, but she thinks it was after the birth of her last child. And she's now at an age where her children are leaving the home, and she's having some more time to pay attention to her own aches and pains. In truth, she's actually been paying a lot of attention to these aches and pains over the years, but doing some pretty unhealthy things around them. She started isolating from friends, stopped exercising as much as she used to. She had to pay more attention to her children growing up, and that was, in some ways, took up the time that she had to devote to exercise and outside relationships. And instead of pursuing those activities, she started eating more. Foods that seemed to be comforting to her, often sugar-based foods, fat-based foods. And now she finds herself at 5 feet 5 inches tall. She now weighs 205 pounds. She hates herself for this. And she's got worsening back pain. She started seeing her primary care doctor 10 years ago about the back pain. And when efforts at physical therapy didn't work, she was put on a low dose of Vicodin. And that has remained a part of her life ever since. Her bowel pattern that was alternating between diarrhea and constipation quickly changed to a constant pattern of constipation with the addition of the opiates. The opiates also seemed to reinforce her pattern of isolating from her friends, isolating even from her family and her partner in life. And the Vicodin didn't seem to do much for the pain except for maybe a half an hour or an hour after taking it, and then she could do her work, either her housework or the work outside of the home. And work outside the home became more and more difficult over the years. Constipation was treated not with changes in her diet, but with other medicines to try to increase the movement of her bowels. She then decided to go to see some other healthcare providers who put her on a huge number of supplements, different vitamins that also didn't seem to have much of an effect on either her pain or her bowels. And she's getting more depressed, and she's feeling more and more foggy along with this. She just can't seem to make decisions about important things in her life, can't remember important dates, and she is now miserable.
Yeah, I remember the number of supplements. Just imagine winning at a Mexican birthday party and smashing that piñata and just seeing all of the candy fall outside. That's the number of supplements. And honestly, I see that a lot in natural health. People go to potentially well-meaning practitioners who just provide so many supplements that it often causes more harm to the gut, because while everything may sound really good on paper, the gut still has to deal with this. And in cases like this woman, she already has a gut that is under siege with imbalances of gut bacteria, and then overloading the system and stuffing her like a piñata full of all of these supplements, it's really adding insult to injury as well as to the bank account.
Yes, this poor family at this point who's trying to work with this actually had to move from a different part of our state so that her spouse could get a job that might pay more, so the family resources could actually go towards more supplements for this woman.
What I was able to find by looking systemically rather than as a list of symptoms was that everything was essentially coming down to the relationship between gut bacteria and the opiate receptors within the gut. So the feelings of love and support that she had been getting from food were in fact leading to inflammation that was exacerbating back pain. So when it comes to back pain, many people will look structurally. Nothing wrong with looking in that direction. Certainly having a big gut will put pressure on the lumbar spine. However, it's also important to look at the relationship between inflammation caused by gut dysbiosis and systematic inflammation in the body. The constipation was not something separate from the back pain or the emotional depression. They're all completely going in the same direction. The first thing that I asked her to do was to limit the number of supplements that she was taking, at least for a few months. We're talking about grocery bags full of supplements. What I suggested instead was that she switched to just having ginger tea in the morning to kickstart her digestion, and then ballparking toward foods that are going to be by nature a little bit bitter and sour. So we're in a desert environment. A local vegetable that grows naturally that has many positive benefits is the nopal leaf. I suggested these as well as a little bit of chili peppers to add to her diet to kickstart and warm digestion and help the gut flora with the prebiotics that are found naturally in the nopal leaves. So instead of taking thousands of dollars of supplements, I was suggesting something that may set her back $2 at a Mexican grocery store. You know, the ginger and nopal leaves are very cheap, very readily available, and having those already had a change on her pain level, depression level, and back pain as well.
You know, one of the things that we're become aware of over the last 20 years in Western medicine is the gut-brain axis. And it is clear that for healthy people, the bacteria in the gut produce more dopamine and more serotonin every day than the brain does. Dopamine and serotonin are normally considered happy neurotransmitters. And one of the things that we find with Most of the medications that we use to treat the symptoms of pain, Vicodin, other opiates, nerve deadening medications like gabapentin, is that they change the motility of the gut. They change the receptors in the gut. And the bacteria that live in the gut change dramatically, so that the levels of dopamine and serotonin change incredibly from healthy people to people taking these medications. Another type of medication that is often used in Western medicine for people who have fibromyalgia, who come in and say, my legs feel tight, they feel heavy, my muscles feel tight, like they're bursting at the seams, is muscle relaxers. And the muscle relaxers that are predominantly used actually don't do anything to relax muscles. They simply cause some sedation in the brain that for a patient like this just increases their fogginess and their overall feeling of distress. So when you see these people with these heavy, tight muscles, what are you beginning to think about, Dr. Miles?
Heavy pain, not to say that it always is, because you never want to be in a state where you're saying this sign absolutely means this, because that's more something like palm reading. But when I hear heavy pain, I will immediately ask questions about chronic sinusitis, history of irritable bowel syndrome, and I look for areas of perhaps a past history of having chronic fungal infections, because generally speaking, once people are in a state of gut dysbiosis, bacterial and fungal overgrowths in the body will elicit a generalized immune response. Sometimes this is called a fever of unknown origin, where people will have a low-grade fever and it's unknown exactly why. Within Chinese medicine, this is at least suggested that you look in the direction of bacterial and fungal overgrowths. And as this generalized inflammation happens, it tends to cause a heaviness in the body. And this heaviness is also associated with fatigue, because with the inflammation, the cells become inefficient at producing mitochondria. So it comes with a kind of lethargy as the body begins to not work as efficiently as it once did.
And I see people who come in and they talk about this heavy pain that they have, and seeing them trying to move is actually feels painful watching them. They have difficulty getting on and off a table, difficulty lying down, simply lifting their legs up off the floor onto a table or a bed is painful for them, because all their tissues are a little bit swollen.
You tend to as well see, when you look at the tongue, that the tongue itself is swollen, and there are impressions from the teeth on the side of the tongue. So the sides of the tongue will be wavy, where the teeth aren't pressing against the tongue is swollen and pressing against the teeth. And the tongue is a muscle that we can see with the naked eye pretty easily. It's not covered by a lot of fat, hopefully. And what that suggests is that there may be, not that there is, but there may be water retention in other areas of the body as well. And as you palpate the legs, as you palpate other tissues around the body, you can find that the tissue itself is kind of squishy. It feels like, that cheap chicken that you get at the grocery store that, they inject with the saline so it's heavier. That's what the tissue starts to feel like. It's is very mushy. And in severe cases, it becomes associated with edema as well. As the cells are in a state of inflammation, the sodium potassium pumps begin to break down. You get water where it shouldn't be. You don't want a lot of water outside the cells. That makes the body very swampy. And in swamps, you tend to find swamp gases, mosquitoes, gators, and Cajuns. And that's not the kind of environment you want inside the body. No offense to Cajuns, but you know the cousin I'm talking about.
I have 3 of those cousins, and I look just like them. So we have a person here who has pain, and this heavy pain in particular. And one of the things that I see in almost every patient with chronic pain, even if it's a different kind of pain, in Western medicine, is that they've been put on some formulation of medication treatment that causes constipation. So what do you begin to think about for these people with heavy pain and constipation?
The overall strategy with heavy pain is to reduce water. And the more there's constipation, the more the large intestine is going to be, taking up that water again that may not be the most ideal water for them to be getting. So the overall strategy is to move stools down and out, increase defecation, increase urination, and lightly increase sweating to just help to improve that water metabolism. You want the old water out and the new water in. It's the same way that you might clean a sponge. So for these kind of people, massage, I find, is really useful because just the physical action of moving the tissues is going to give them something similar to exercise, whereas the muscles themselves may be pretty fatigued. So if they're drinking water that's healthy for them, get a massage afterwards, urinate. That's the basic idea, is to increase bowel movements, increase urination. We tend to use plant-based interventions to regulate water metabolism. It's also important to address blood sugar, blood lipids, as well as use immune regulatory herbs. Reducing fungi and increasing antioxidants in the body is also a pretty essential aspect of this. And find that constipation and obesity are both associated with having measurable methane on the breath. So methane should be going down and out, hopefully not in a car or elevator, but somewhere aerated. And when that doesn't happen, people become full of this pathogenic gas that should be leaving the body. And on it, pathogenic bacteria come, and you can often smell it right on the breath of people. And it's not the kind of state you want to be in, where it's been such a swamp that the swamp gases are reaching across the room and punching people in the face, metaphorically. You want the gases to be moving down and out as well as the stools.
I often wonder if some of the isolation that the social isolation that these people seem to adopt is a reaction to some of the gases that they're giving off. And, they're getting negative feedback from people around them because they just don't have that odor that attracts other people.
It's interesting. I saw last year that there's a cloud of bacteria around all of us. And, when dogs greet each other, they go right to the source and say, "Hey, buddy, what's up?" They go right to the anus and say, "What's going on with you? What's going on with your immune system? Because I can probably find out something about your personality that way." Now, my nose isn't that strong, but it turns out that all of us have this kind of bacterial aura about us. And the color of that aura is probably brown because the majority of it is, in fact, fecal bacteria. So that's something you probably could have lived a very happy life not knowing. But the reality is that this bacteria, which surrounds all of us, as it interacts with other people's bacterial force field, which is also interacting with the gases, because anywhere there's life, there's going to be an interaction between that life and the gas around it. So your bacterial force field is putting off certain gases that another person's body is able to pick up on. And just, think of the most annoying person you know. How do they smell? You don't know because you try to avoid them, but at some kind of intuitive level, your body knows that they're carrying something nasty and you want to be away from them. And over time, if we cultivate swamp body with its swamp gases and its, microbial alligators, other people don't want to be around it. And it becomes something that, you can't smile your way out of. You can't say the right canned responses. It's something that becomes literally repulsive to other people. And that's very sad to see people who are, maybe through no fault of their own, they just moved to a new city, they're a little bit socially isolated, they're getting that hit of dopamine and serotonin from, cinnamon rolls and cheese and whatever else. Pretty soon they have swamp body, their body's rotting, and, people don't want to be around rotting people. That's evolution.
There's the other aspect, or another aspect here is that tragically, many people with these chronic, poorly defined pain were sexually abused as children, perhaps sexually abused as adults, but quite often as children. And there is, for some people, an unconscious desire to want to keep their potential abusers away from them. And a way to do that is to unconsciously develop this cloud that keeps people away. It's a defense mechanism, which on a conscious level and an unconscious level, as people start to feel more pain, more depressed, they seek out their comfort foods that actually reinforce the opposite of the joy and happiness that they really would like to have.
It's a very bitter irony. It's as though there are burglars trying to get in the window, and so they just start opening cans of tear gas, which poisons their own internal environment. This is why it is very hard to separate what would be stage 1 in regulating immune factors and the gut itself. Strategically, we take different points of view, but realistically, these are just entirely intertwined, because we're dealing with the way that gut bacteria affect the immune system, how emotions and those emotional boundaries interact with the immune system and with the gut bacteria that people cultivate inside. And there's definitely no one-to-one interaction. It's not like eating pepper will make you into a superhero or something like this, but these are all aspects that play a role in whether people take care of themselves well or not, whether they think that they're worth it, and what kind of gut bacteria are being cultivated in those cases. Are they abusive gut bacteria who are hijacking opiate receptors and demanding they get what they want? The same people are often, unfortunately, inviting people into their life who are likewise pretty predatory. So the first two stages on a physical level and emotional level have to do with setting those boundaries and getting rid of the bullshit.
And doing that is a process of building that strong foundation for going through the other stages of the healing process. And building a strong foundation, there's no way to build anything but a weak house above a weak foundation. So we have to start
out with the old.
Yeah. And whether it's stage 1 or stage 2, as you say, they're so intertwined, but you have to pick some place to begin working with people and get one factor, a solid foundation, and then build off the other so that you can move on from there.
So as an overall strategy, we want to be, again, increasing bowel movements, lightly increasing sweating, and regaining that thirst mechanism. Oftentimes people who have water retention, they don't feel thirsty even though they're dehydrated. Or they may be drinking lots of water, but it's not necessarily getting to the cells. It's just kind of adding to the swamp. So people will say, I know I should drink, or I feel thirsty, but I don't feel like drinking. It's this weird mixture of a signal from the body saying, hey, you should drink water, and another saying, hey, we're backed up. We already have too much to deal with. So increasing use of your spice rack, increasing pepper, limiting salt, these can all help to restore healthy gut bacteria. Enjoying fermented foods, as well as increasing cooked mushrooms in the diet, have all been shown to increase diversity in gut bacteria, in gut flora and fauna, if you want to put it that way. Little deer like Bambi prancing through your intestines. Anyway, in doing so, it can help set the stage for healthy microbiota, which in turn will help to reverse some of these symptoms, both emotionally and physically, that people have been going through.